Hello, and welcome to OIL's 593, Exploring Virtual Worlds. My name is Joseph Candelaria, and my partner was Jessica Madrano. Our project is a patient assessment scenario-based learning experience for emergency medical services students. As EMS educators, we partner to appeal to the next generation of EMS students. Our goal was to provide an experience in an immersive learning environment in Second Life and create a safe learning environment for EMS students to learn critical thinking skills and situational awareness. In a traditional classroom environment, it's very difficult to create an unsafe scene in the real world. In Second Life, we created a scene where you use weapons, drug paraphernalia, etc. in a virtual world where the student can experience these scene issues in a safe environment. Our project design is a virtual world with an outdoor classroom, a student lounge and resource area, a hospital, and 3 mini homes that each represent a scene that the EMT must have that have been called to and must enter. The EMTs must determine what scene hazards exist, how it would affect their patient care, how it would affect their patients, how they would manage a difficult scene. Nothing fully prepares an individual for all the variables of entering a home, business, or social environment to take care of a patient, and we often take this critical skill acquisition for granted. Our project is designed to train students to use their senses while also honing the required skills to take care of a patient. Immersion in this type of environment is something educators could be doing for all students interested in the fields of fire and EMS. So if you'll hold on 1 second, I will take you to our student lounge. Hello again. This is our Student Resource Center and Lounge. What you can do in this center is we built for collaboration. You can listen to YouTube videos. You can watch your favorite Khan Academy video. You can discuss what you've learned today's lesson. In this area, it's built to be collaborative, to get them away from the scene, get them away from the classroom, and put them in a student lounge area where they can learn and talk and discuss things that they've learned today, things that have impacted them the most, and how they can better utilize the skills they've learned in the other areas of our virtual classroom. So if you hold on, I'm going to take you to our virtual classroom. Okay, welcome back. This is our virtual classroom. We set it up in an outdoor seating area where students can come and sit and watch the traditional PowerPoint. In this case, we're talking about the patient assessment and scene safety. So we'd have our patients sit around in this area, discuss what we've learned, talk about the principles and the things behind scene safety, all the key areas of education, and we can do any kind of traditional classroom in here. We also added some resources for the students so that they can further gain knowledge. In this corner here, we did what's called a think book, and in this think book, in the think book here, you can click on it and it gives you just a little bit more information. It's an interactive book that allows the students to talk and think. This one here is specifically talking about using your senses. It correlates to what they're about to go through in the scene, in the emergency scenes that we've created for them. But we also create different scenes where they can go through, and this is a different scene. Why is that important? Why is it having a bunch of crowds there? Is that dangerous? Is it something we need to be concerned about as EMTs? We've created other scenes where you have different types of hostile crowds, maybe some protesters. Responding to those kind of scenes, what are really we concerned about when we're talking about EMS? So that's what we've created here. So we've allowed for a virtual classroom where you can have your traditional PowerPoint lecture style of learning, and then also some aids that will assist them to further learn and prior to going into the scenes that we've created for you. So if you hold on, we'll take you to the first scene. All right, and welcome. This is our first scene that we've created. In this scene, we wanted to have a party type scene where there's some situations that may present some dangers, or at least some situational awareness things that the student will have to think about prior to entering a scene like this, and how we're going to control it and ensure that we can take care of our patients. But the first part of what we're going to do is you come and you click on this box here, and it opens up for you a quick note card. And in the note card, I'll bring it in. It says, you have been dispatched into a house in a frat row at UNM. Someone has called 911 and said, my friend is in this party and acting weird. Then they hung up. Please enter the party and create a mental list of all the hazards in this scene. Also try to identify who your patient might be and based on the dispatch information. So I'm going to walk you through and give you an idea of what the student is going to experience in this virtual world, and then what we're trying to accomplish as the creators of this virtual world. So as you immediately walk into here, you can see it's kind of chaotic. You got people dancing. You've got a bunch of alcohol, different types of balloons. If you walk over to this corner, you have different kinds of hazards. Right there is a weapon. It's a gun. The student needs to know how we're going to secure that gun. Is that something that we need to be worried about? Do we really control this environment in this scene? So it can be very dangerous, especially for EMTs to enter this, but it's hard to create in the real world, but we've been able to do this in the virtual world. And then of course, we're going to facilitate them through. Right here in the corner, you got a young man who's standing there in the corner, kind of off to himself, not really participating. Is he a danger? Is this something that we need to be worried about? What we're trying to do is create discussion. So if you will give me a second, I will take you to the next scene. Okay, and this is scene number 2. In this scene, what we've tried to create is another pretty dangerous environment in which the student's going to have to use some critical thinking skills to, again, understand how they're going to respond to that, what resources they need, and other things. So let's take a look at the note card. So if you get the note card, this is what typically would be what we wanted them to know prior to getting to the scene is you've been dispatched to a residence for a possible shooting or stabbing. Police arrive at the scene at the same time you do. Please advise what you would do on this scene. Are you safe? Where is the weapon? These are all things that we need to think about when we're entering this kind of area. And we face this a lot in the EMS. However, it's hard again to put them in an environment where they're really going to get to test their knowledge and skills. So let's take you through into this scene. Okay, so in this scene, we've created an environment here, or we've created a scene where we have a potential, what is this? There's a weapon there. There's a gentleman lying in the bed, potentially fatally injured. You've got lots of blood and really gory scene here. You got a gentleman there. What's he standing there for? Is he part of the problem? Is he assailant? Is he family members? A lot of questions that we don't know. And again, if we come into a scene like this, that would be a very dangerous thing to do. So a lot of these things we want to create this environment for our students, so that way they can kind of get an idea of what to do, come out, be facilitated by the instructor. What would you have done? What are some of the resources you may have needed, and really what are some of the learning points? One of the unintended things that we and the feedback that we got from this is that this also creates a very traumatic event for the learner, and it brought up some emotional stuff that we talked about in the course that said, well, how do we treat the EMT? What's the well-being of the EMT for having to see these kind of things? In this day and age, a lot of firefighters, paramedics, they're all being diagnosed with PTSD. They're linking that to our careers. So this again creates an opportunity for us to talk and discuss about how not only to take care of the patient, but also take care of ourselves, not just in the short term of inside this scenario, but outside of how long term do we take care of our child, dealing with PTSD and dealing with the things that maybe might cause us some long-term issues. So if you hold on, I will take you to the last scenario. Okay, so this last area, I mistakenly said it was a scenario. It's not necessarily a scenario. This is a place for our students to come in and do some reflection, looking at some different various scenes that they may encounter, and having some time to discuss what they may do, what are some of the challenges, and we wanted to create this so that way they can have an environment in here where as they're waiting to go into the other scenes, they can discuss what are some of my problems or issues. We can click through this slideshow here and it would give us difference, and I'll go ahead and do that for you. But you can see here how this creates a very dangerous scene. We got a lot of people on the highway here. There's a lot of vehicles. As an EMT, how do we control this area? What are our patients? Where's our nearest hospital? There's a lot of questions that need to be discussed in here, and it's an area to create some critical thinking skills. Additionally, here's a very dangerous environment, and we just want to kind of put our students in an area where they start to develop some critical thinking, really start working through scene management and command presence and things that it's very hard to teach, like the affective side of learning. So these are just some areas that we wanted to bring, and we've done a bunch of different scenarios here. This is a gentleman hanging off a cliff. How are we going to get to him? What are we going to do? How do we talk to them? Stuff like that. This is this room. It's just a multitude of different scenarios. Okay, and in this last area, what we wanted to, as you can see, somebody was driving our ambulance over there in the corner. We were able to have it so that way it's drivable. But there's our ambulance parking area, and this is our hospital. A lot in EMS, what you learn is how to take care of patients, how to manage scenes. What we really don't get is how do you ensure the continuity of care has been taken? How do you turn these patients over to a higher level of care? That's a really important part of EMS and medicine in itself, that it's kind of left out in classrooms and you learn on the job. What we'd like to do in this virtual world is to teach them to not only manage the scene, take care of themselves, prioritize their treatment, but also do turnovers with the hospital staff to ensure that the patient is getting the best care. So let me take you and walk you through our hospital. So our students would have to come through here, and they would come into their hospital, and in the hospital here is where you would have an instructor that would be facilitating the transfer over of patient care and continuity of care from the EMT to the healthcare provider. There's some very important things that need to be said. The patient's history. What did the scene look like? Can you describe it to me? What is the chief complaint of the patient? What have you done for them? Are there any medications or treatments have you done? Have they worked? Have they not worked? It's a opportunity to dialogue and to really work with your instructor who's going to be facilitating this, so that way you get a full view of how to take care of a patient from responding, from dispatch, all the way turning them over to and getting ready for your next call. So that's what we've created here. So again, I just like to thank you for taking the time and looking at this project. We were very excited about the opportunities that it presents us as EMS educators, both at UNM and at CNM with Jessica Medrano. We have built this scenario, and we look at building more scenarios where we can place our students into some real world, flip the classroom type education, so that they learn how to be EMTs in a safe environment, and we create discussion and alternate ways of learning. So thank you very much. Again, this is OILS 593, Exploring Virtual Worlds.